next speaker, Rishi.
Dr. Anita,
Yeah.
if you want this side. And next is
Okay.
Dr. Pratibha. Dr.
Good morning,
Pratibha
all.
is here.
Yes, sir.
Yeah, please start.
Good morning, all. My paper presentation is on a cross-sectional study of anterior chamber angle parameters and biometric parameters in patients with shallow anterior chamber and their siblings at the tertiary care center in Eastern India. Glaucoma, as we know, is a chronic progressive optic neuropathy leading to irreversible blindness and mainly is of two types, open angle and close angle. However, close angle glaucoma, it leads to 2.5 times more blindness compared to primary open angle glaucoma. And a positive history of glaucoma is an important risk factor which predisposes sibling to shallow angle to angle closure 8.8 times compared to the normal general population. The slide stuck. So these are the abbreviations used. My primary research objective was to evaluate the difference between the anterior chamber angle opening distance at 750 microns from the scleral spur in the two groups, which were probands and siblings. And the secondary research objective was to evaluate the different angle and biometric parameters. So my study design was cross-sectional and observational, which was done at ophthalmologic OPD and recruited 20 to 60-year-old males and females. And outcome variables were measured. As they were continuous variables, it was analyzed using independent t-test. The patients were recruited who had a shallow anterior chamber of VH grading 012. Consent was taken and they were counseled to bring the sibling along on the next visit, and they underwent AIOS2025 with Heidelberg spectalis and biometry after consents. And the outcome variables were measured. So here is the slide of the AIOS2025, which is showing the angle parameters, of which in my study the concern was of anterior chamber width, which was the distance between the two scleral spurs. Lens fold, which is the horizontal distance which is the perpendicular drawn on the ACW to the anterior surface of the lens. AOD 750, which is the opening distance at 750, we already discussed, and TISA, which is trabecular iris space area at 750 microns. Here is an image of my patient in which I am showing the 4 parameters. It was measured at the nasal and temporal angles. And this is a magnified view which is showing the AOD, ACA, and TISA. TISA is the orange enclosed part which is trapezoid in shape. And here is the biometric parameters which was done using IOL Master 700. And the parameters which were studied were axial length, TK1, TK2, anterior chamber depth, and lens thickness. So in the results, the major population of study was, the participants were 84% females, and there was not significant, statistically significant difference in the age of the participants, and all the variables were normally distributed, and as I said, t-test was used. So here is the nasal AOD 750 and temporal AOD 750. It showed significant statistical difference in both the patient and the siblings group. There were other 9 variables which showed statistically significant difference in both the probands and the siblings. There was again a subgroup analysis done with the patient and sibling pairs. They were divided into 2 pairs, concordant and discordant pairs. Concordant pairs were the siblings with the probands and the siblings both having shallow anterior chamber, while discordant pairs were the siblings who had an open angle while the proband had a shallow anterior chamber. Of which 7 variables showed the difference between there was statistically significant difference in the discordant pair, but there was not statistically significant difference in the concordant pairs. So my conclusion was that the 7 variables which I have studied, the nasal parameters of AOD 750, TISA 750, ACA 750, the lens volt, anterior chamber depth, axial length, and lens thickness, they can be used as screening tools using AIOS2025 to screen the concordant siblings who are predisposed to shallow anterior chamber. And however, the corneal parameters which were analyzed were not statistically significant in both the groups and not even in subgroup analysis. Thank you.
Thank you. So, which OCT did you use? Which AIOS2025?
Ma'am, Heidelberg spectalis ACA module.
Okay, so what is your like the family member should be screened on AIOS2025 to rule out glaucoma? Is it feasible?
Ma'am, we can use of which the parameters which were to be concerned when we are doing ASOCT in the siblings were the nasal values, lens volt, anterior chamber depth, and lens thickness.
So you can use it.
Yes, ma'am, we can use it, and
How practically feasible it is, I'm asking that, my question is. For screening purposes.
ma'am, actually this thesis was done in
Okay,
the
thank
government
you.
setup, so
Just one question.
no,
You
it's
said
not
that
like
there was a
this.
significant difference in the concordant, whereas in discordance there was no significant difference, right?
in few parameters, yes,
Yeah.
sir.
So, how did you define the concordant and discordant just from the presence or absence of open angle?
No, sir. Concordant pairs were the patient already had shallow anterior chamber, but the sibling also have shallow anterior chamber were concordant pairs.
So that means, if from your study, all we need to see is whether the siblings have a shallow anterior chamber or not. And
Yes,
they will
sir.
be statistically significant. That's what your study says.
Yes, sir.
Isn't that correct?
Yes, sir. To find out that, matlab how many siblings also had shallow anterior chamber, and also what the parameters which we can use to differentiate the siblings who have shallow anterior and open
Your
angles.
recommendation will be just look for siblings with similar kind of anterior chamber. Is that right, or am I getting it wrong? What is your recommendation?
Sir, like all the parameters which were matching to a shallow anterior chamber, clinically also those siblings had VH1 to grading. So definitely, like if the sibling is having shallow anterior chamber, we should go for an ASOCT. And if the sibling is having
We
open
can also do
chamber,
gonioscopy, like that is what I was asking. Is it feasible to do ASOCT for screening of all? Can't you do gonioscopy?
no, ma'am. Then it will be for shallow anterior chamber.
That's what
Yeah.
sir is saying. First you
Ma'am,
do
I
the
got your question now.
one-erix.
Yes.
If
Yeah.
it will